Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez, and today we have the pleasure of introducing to everyone Dr. Timothy Miller, who is right here at the Marcus Neuroscience Institute. And the phone number there is 561-955-4600. And the location is 800 Meadows Road, right here in Boca Raton, Florida, 33486. And Dr. Miller is a neurosurgeon. Thank you for coming on the show, Dr. Miller.
Thank you. It's a pleasure to be here.
It's a pleasure to have you. I'm always fascinated with the brain and neuroscience and neurosurgery. But if you can just share a little bit about your background, where'd you go to school? What made you want to become a doctor? What piqued that interest?
Sure. I've wanted to be a doctor since I was a kid.
Nice.
So I don't really remember what initially spurred that on, but it's always been a desire to help people in a way that many others don't have the opportunity to do, and it really is a pleasure. I trained at Duke University, and I've been here in Boca Raton for going on my 7th year at the Marcus Neuroscience Institute, part of Baptist Health.
Well, we're lucky to have you here so close.
Thank you.
Yeah, and if you can share with us a little bit about the Marcus Neuroscience Institute, what all do they do there at the Institute? What kind of patients do you see? What do you do?
The Neuroscience Institute runs the full gamut of neurological care, including neurosurgical services, neurology services, neuro-oncology. We've been in the community for going on 10 years thanks to a very generous gift from Bernie Marcus, one of the co-founders of Home Depot, who through his philanthropy has allowed us to remain innovative and stay up to date with current technologies and allowed us to really keep up with the latest innovations and also participate in studies which we otherwise would not have been able to do.
Can you share with us a little bit more? I know you have a lot of technology there, but I'm looking, we were speaking before a little bit about the HIFU. What does that technology, what does that acronym stand for? What does that mean?
So we call it HIFU for short. HIFU stands for High Intensity Focused Ultrasound. And this is probably one of the newest technologies in the neurosurgery world for treatment of a condition called essential tremor, and also can be applicable for patients with tremor-dominant Parkinson's disease. Both of these disorders essentially cause an uncontrolled shaking of the hands that can be effectively and safely treated with ultrasound in a non-invasive way. It's done in an MRI scanner. It's an outpatient procedure, allows patients to be treated almost immediately, leave the facility with tremor control, and really leads to improved quality of life.
That's amazing how this technology is just getting better and better every year.
It is.
Can you share with us, how would somebody know if they're beginning to get a tremor when they go see you, like the distinction between Parkinson's and tremors? So that's maybe not clear to a lot of us who see the person out there having that shape.
Essential tremor is a bit easier to diagnose. It's typically starts with a low volume shaking of the hands. that then typically gets worse over time. It oftentimes starts in the 30s or 40s and gets worse throughout life.
Wow.
And it doesn't have a lot of the other characteristics of Parkinson's disease,
I see.
such as gait difficulties and rigidity of muscle movements.
I see.
So really is more of an uncontrolled shaking. People often report difficulty drinking, eating soup in public. I've heard here in Boca people having difficulty putting a golf ball on the tee. So,
Yeah.
I mean, this really can affect people in
Sure.
many different ways, but we're lucky to be able to treat it now with the newest technologies.
Yeah, absolutely. Is this something that are you looking into? Is this genetic or any idea
It
how this
is-
comes about?
In fact, it is familial. We don't fully understand what we call the pathophysiology, the
Okay.
way that this tremor works, but we do know that there's a target in the brain where if we can affect those cells' function, we can halt the tremor or at least improve the tremor.
That is so interesting. I'm also curious, is this something more dominant in males or females, or is
It's about equal.
Okay.
There's a slight gender predominance, but about 50-50.
okay? Because I remember I had a doctor once who was talking about Parkinson's, and I believe they said that was maybe a little higher towards men. if I believe
yeah, that
correctly.
is true. But it can occur
Sure.
in both genders as well.
Okay, interesting. So if someone is listening right now, by the way, I do want to have a call-in number. If anybody's listening, they can call in. Are you okay with that?
Of course.
888-994-4995, Studio A. We have Dr. Timothy Miller, who's right here, Boca Regional Hospital at the Marcus Institute, who is a neurosurgeon. And I think it's always refreshing for us to know that surgery is not going to be like the first option,
Of course.
right?
Yeah, I mean, that's one of the sort of tenets of our practice is that we very rarely will offer surgery as a first-line therapy, with few exceptions. Of course, the
Sure.
brain tumors sometimes need surgery right off the bat. But for things like essential tremor or Parkinson's, we often like patients to exhaust medical therapies before we offer
Okay.
surgical therapies.
So what type of medical therapies have been conventional up until now for tremors? Is there medication?
Yeah, there's a
or-
number of
okay.
medications, primidone, propranolol, a few other medications that patients will typically try. Unfortunately, a lot of them come along with side effects, and so
Yeah.
patients just don't like those side effects. And in those situations, we would consider that a medical failure, and then patients would be considered for surgical therapies.
So who would be the best candidates for the HIFU technology?
A great candidate, we have sort of a call-in line for, and with screener questions is somebody who has tried medical therapy and has not done well for one reason or another. Either the medication failed or they didn't tolerate the side effects. If they've been diagnosed with essential tremor and have failed these treatments, then they would most likely be a candidate for the ultrasound therapy.
Yeah, so anybody listening, or if you know a loved one or you have somebody, you can feel free to call in 888-994-4995, Studio A. We have Dr. Miller. So, what's the prep for the HIFU before you have that treatment done? What does that look like? So once somebody calls in, what are like the next steps that would occur?
We have a patient care coordinator who runs through a list of screener questions to determine whether patients would be a candidate for the high-intensity focus ultrasound. If the patient clears that sort of screener, then I meet with them in the clinic and we talk about the procedure, the efficacy, the potential side effects, and sort of how the day looks for that patient coming in for the treatment. And if they like to proceed, then we get you scheduled.
What are some of the side effects of the HIFU technology?
Patients can experience some temporary weakness in the hand that's treated, some balance difficulties, and then sometimes some numbness and tingling of the fingertips or right around the mouth.
Okay.
Those are typically temporary, and only 4% of those
Okay.
are permanent. And typically, in even those 4%, they're very mild.
I see. And is this multiple treatments that they have to come back, or is it one and done? How does that, or is it case by case basis?
It is a bit case by case. It's intended to be one treatment per side. So oftentimes,
side.
correct. So we can end up treating both arms, but they have to be separated by 9 months.
Okay.
All right, so we can treat, for most people, it's the right hand, right arm, and then bring the patient back 9 months later and treat the left arm if they wish. Some people are very happy with just control of one of their hands because
Sure.
they can eat and drink in public,
course.
and that's, so it all really depends on the patient's goals.
I see. That makes sense. So how do essential tremors start, and why does it occur? I think we kind of touched into that, but, are there any other factors, lifestyle factors, or is this still unknown and you're doing
Well,
research?
There is ongoing research. We don't have an exact reason for why these tremors occur. We sort of understand the pathways in the brain that lead to essential tremors, and we certainly understand which areas of treatment can improve these essential tremors. And it's a specific area of the brain called the VIM nucleus of the thalamus. And this is a very small, sort of 5 to 6 millimeter area of the brain that we can target with either deep brain stimulation or this high intensity focus ultrasound. But we're still learning.
Yeah, and as you still learn, and we get to benefit because people want to get treated, and I'm imagining they're willing to do certain things to take maybe risks and say, I want to do this. So it's a win-win for everybody, I would imagine, right?
Well, I certainly think this new technology allows us to treat people who otherwise would not want to be treated with deep brain stimulation, which is an invasive surgical option. So I think it sort of lowers the entry point to where people might want to be treated with something other than medication.
Yes.
So certainly a great new option for us.
So are they sedated when this is happening?
No.
Or, oh, okay.
In fact, yeah, we want people to be fully awake and participative in the entire procedure.
Okay.
So we do a number of sort of heatings of this small area of the brain. One is to target the specific area of the brain, and then there's a test lesion where we heat up the brain just to a point where the neurons start to function aberrantly. And we can go into the MRI scanner and
This is
test the
fascinating.
patient, have them draw a spiral, a line, draw their name, and we make sure that we're in the exact right area of the brain. We also want to make sure that we're avoiding side effects, right? So we ask about numbness, we ask about weakness, we test out their coordination. And if all those things are good, then we just heat up this area of the brain a few more degrees and create a
Wow.
small lesion in the brain. And that's typically effective.
Interesting. So you're actually heating up
Correct.
portion of the brain, and then that heat in return reacts in a way where it
Yeah, I mean, the ultimate goal is to ablate, which is essentially melting
Yeah.
small neurons in this tiny, tiny portion of the brain, and that disrupts this tremor pathway. And we're able to see that immediately.
that's interesting. So when we talk about brain pathways, please educate us. Can you share with us what are the different I mean, I don't know. This is a layman's question, but can you share with us brain pathways and what exactly does that mean, and a little bit more about that, because we do have
Yeah,
different pathways too. Well, actually, we have a commercial break. Can we touch on that when we
Sure.
get back?
Let me
Thank
think
you.
about it for a while.
Okay, thanks. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare. I am having a great conversation here with Dr. Timothy Miller, who is a neurosurgeon. We're learning all about the HIFU technology. And Dr. Miller, you did want me to give out a phone number. I will give it out for anybody. Who is it? First, remind me, what is this phone number for anybody who...
Well, I think it's for patients or family members who are concerned that either they or a family member might have essential tremor.
Okay.
And this goes to our patient coordinator line.
Okay.
And this is where you can kind of go through the screener questions to see if you might be a candidate for high-intensity focused ultrasound, or HIFU.
Okay. And that is 561-955 HIFU, H-I-F-U, which is 4438. 561-955-4438. You know, I'm happy to say there's so much new technology nowadays that seems to be less invasive and more accurate and just amazing. I can't imagine what the technology is going to look like 10 years from now, right? The way it seems to be growing exponentially. What do you think as far as next 10, 15 years as far as technology in the brain?
Yeah, I mean, this is sort of the last frontier of medicine, I think. I think brain physiology and connectivity is one of the areas where we still have quite a lot to learn, and I think there are probably decades or centuries of information ahead of us. But you're right in that the technology and our understanding of the way things work is evolving so quickly that we're able to offer patients the newest therapies on the spot.
Yeah.
I mean, quickly translating from animal research to patient research to treating patients. And this is something that's really only been around for about 5 years, this HIFU thing. Mm-hmm. But we've gotten pretty good at it and continue to get better as the technology evolves and gets better.
So in Florida, are we the only one who has that, or is there anybody?
In Boca Raton, we certainly are. No, there are a few facilities in Florida, that have
Okay.
in Miami.
If anyone else is listening, maybe on the west coast of Florida, if they're,
Yeah, I'm not sure about on the West Coast. I haven't heard of a facility. I know in
Okay.
Orlando, I think there are some.
Okay.
But certainly for our listeners, Boca Raton
Oh,
is a great
absolutely.
place to come
Oh, I
visit.
know that.
We have patients coming down from hours away, and really what this requires is just a day. You come in
Yeah,
for a day,
I was going to ask you that.
and you're able to leave after a few hours. We do ask patients to stay the night to get an MRI scan the following day, just to confirm the lesion. But even that is not a strict requirement if
Got it.
somebody really had some restrictions and had to get back. But it doesn't require hospitalization. There's no invasiveness here, and really it's quick and effective treatment. Patients feel better right away.
Wow. I'm sure the family, everybody must just be so excited to know that this has been, can change this person's life so dramatically.
Oh, yeah. It is super emotional for patients and their families. And we've seen people cry,
Of
tears of
course.
joy,
Of
course.
course.
And, even for us as the treatment team, it gets a bit emotional in a good way.
Of course.
Yeah.
How many patients would you say that you've treated so far? Any idea, like how many are coming in a week or a month or?
Oh, we're seeing many per week. I see 2 to 3 patients in clinic each day that I run a clinic that are interested in this therapy. Now, not everybody's a candidate, of course.
Okay.
We just got our facility up and running in Boca Raton here last week.
Oh, nice.
Of course, I did this at Duke where I trained before, but we're really happy to be able to offer this locally.
Oh, absolutely. So some of the people that are coming in maybe are not a candidate. However, are they leaving knowing answers to maybe, okay, I thought I had this type of tremor, but maybe I have something else? are they leaving with a diagnosis or leaving with a better idea of how to treat?
Well, I hope so, or at
Okay.
least a better understanding of options. Most of these
Good.
patients are coming to me with a diagnosis.
I see.
And there are certain situations where we identify maybe that this is not the right diagnosis, and maybe they do have some signs of
Oh.
Parkinsonism or a different type of tremor, because there are many types of
Oh
tremors.
yeah, we have to talk about that. That's a whole nother
Well,
layer,
yeah,
right?
certainly there's toxin-induced tremors or cerebellar-induced tremors. So not everybody has essential tremor, but some of the things that lead us to believe the patient has essential tremor would be family history.
Mm-hmm.
We often ask about does an alcoholic beverage calm your tremor, because that's very
Interesting.
common with patients with essential tremor. And then we ask questions that rule out Parkinsonism or Parkinson's disease.
Right.
And if there are any concerns, we are able to get patients tied in with our movement disorder neurologist, with whom
Nice.
I work very closely. And we treat patients with Parkinson's in other ways, typically.
Nice. So you said there are other types of tremors just on the spectrum. Like how many other tremors are we talking about?
There are
There's
probably a
just
few
some-
dozen, but
Really?
there are about
Okay.
5 or 6 main types of tremor, including Parkinson's disease,
Sure.
Parkinsonism, essential tremor. There's a cerebellar type of tremor, and then several others.
Okay. So they're all affecting different parts of the brain. Is that how it is, or?
There are some commonalities in pathways. In fact, patients with tremor-dominant Parkinson's disease can still be treated with high-intensity focused ultrasound with the same brain target. So there probably are commonalities that we don't fully understand.
Got it.
But oftentimes there is involvement of the cerebellum and the thalamus, which is the area that we treat with this high-intensity focused ultrasound, or HIFU.
So the cerebellum is what part of the brain you said? It's
It's like the mini brain. It's the back part of the brain that we normally think of as the coordination and balance center.
Okay, so that's its function, coordination and balance.
For the most part.
Okay, got it. Interesting. Yeah, it's so trying to see what else. Oh, this is a great question. How long does the treatment last in patients once they have it done? Do they need to come back in a certain amount of time?
Great question. Yeah, I mean, so the data on that is still evolving and actually improving over time as we learn more about this and how to target this tiny little area of the brain. But what we do know is that about 70 to 80% of patients still have good tremor control at about 3 years out from treatment.
Oh, wow.
Right, so there may be some recurrence of tremor in the first few years, and in those patients we can actually retreat the area. So the thought is that maybe we didn't heat things up quite hot enough
I see.
in an effort to avoid side effects.
Sure.
But we can tailor that treatment on the second go around and sort of move things around just by millimeters to try to become more efficacious.
That is fascinating. Dr. Miller, we have 2 minutes left, actually. Any last shares? Please feel free to let us know. Maybe something we didn't discuss or a takeaway, or you want to talk to the audience and just let them know a little bit more about, the center and what else you all do there. Anything you want to share?
Yeah, I mean, as far as Marcus Neuroscience Institute at Baptist Health, part of Boca Raton Regional Hospital, we offer a complete gamut of services from neurology to oncology. We work in a multidisciplinary team with our oncologists and many other physicians to treat patients with neurological disorders. We have many neurologists, and we have subspecialists in neurosurgery who treat everything from complex spine to skull-based surgery, which is sort of a subspecialty of brain surgery.
Wow.
To endovascular treatments, and then sort of the things that I do, like movement disorder, epilepsy, and pain syndromes. And as far as sort of my subspecialty, I'm really passionate about this HIFU thing. I think we have a lot of patients in Palm Beach. In fact, there are between 500 and 1,000 patients
Nice,
in
yeah.
Palm Beach County who have been diagnosed with essential tremor that I think would be good candidates for this. So
Wow.
reach out to us at 561-955-HIFU if you feel like you might be a candidate for this or would just like to discuss options. We'd be happy to see you.
Well, thank you so much for sharing. We got to get the word out because this is really relevant to a lot of people. So Thank you for coming on the show and
I
sharing your
appreciate you having me.
passion.
Thank you so much.
Absolutely. Thank you, Dr. Miller.
Happy to be
Pleasure.
here.
All righty. We'll see you next week, everybody, for another episode of You and Your Doctor. Take care.